Hey, I'm Erin. I played rugby for the Austin Huns. A couple months ago, I had a traumatic brain injury, cracked my skull. Some of the symptoms, light sensitivity, major pain, headache pains, as well as sounds were really affecting me. It kind of messed me up. I wasn't sure if I was ever going to be able to come back to it soon. The doctor didn't really have a treatment plan besides time and rest. So I wanted to find something to get me back to normal faster. On the first treatment, I felt amazing. My headache instantly went away while I was in the chamber. After 5 treatments, my light sensitivity went away. My headaches were gone. After 20, my CAT scans came back normal. The brain waves were great. I'm super excited. I feel amazing. I'm looking forward to what improvements that come to follow.
Every day at Permobile, we are helping families battling disabilities throughout the world. Our company was founded under one belief that every person has a right to independence and mobility, and that idea is as strong today as it's ever been. Our passion goes into building wheelchairs and complex rehabilitation accessories so that every product is customized for every individual's needs. We are so passionate about giving back to organizations such as Team Luke Hope for Minds that in 2017 we started the Permobile Foundation so that individuals can live a life without limitations. The Permobile Foundation helps them by sponsoring fundraising events, by building accessible playgrounds, and by providing donations such as equipment so that these individuals have access to their independence and mobility. Permobile and the Permobile Foundation are honored to partner with Team Luke Hope for Minds in their efforts to support families and children battling brain injury.
Good morning, everyone. My name is Erin Stranahan. I'm an OT at Napa Center, Austin. As Reed mentioned, we utilize a variety of different modalities within our practice. We do intensive and traditional therapies in OT, PT, and speech. So I'm going to discuss with you some of the improvements that we've seen in a lot of our patients with the use of whole body vibration. So what is whole body vibration? It is a tool utilized in a variety of different settings. So some of you may have seen these. I know years ago I'd seen them in gyms. I had heard about them being used with professional athletes, and then in the elderly population. And recently there's been a lot more research within neurorehabilitation and more specifically recently in pediatrics. So it is used in a variety of different settings, including fitness and athletic performance, also women's health, mental health and for stress reduction, aging and fall prevention, and the prevention and recovery in back pain, as well as management of adiposity and leg blood flow. The overall benefits in all these different areas include improved muscle function, flexibility, postural control, joint stability, balance, improved proprioception, energy levels, mental alertness, arousal levels, bone density, and agility. More specifically, the benefits that we see in neurorehabilitation include increased proprioception, increases in balance, improved range of motion and flexibility, which assist in the reduction of contractures, reduction in spasticity, improved blood flow and circulation, and a variety of studies demonstrate improved MGMFM scores. So stimulation of the neuromuscular system and neurological communication optimizes neuroplasticity. So we're always trying to tap into neuroplasticity, as Dr. Crawford spoke to if we were in his last session. The proprioceptive input provides awareness of body position in space, allowing for more coordinated and graded movements. Improved postural control, improved gait and walking speed, and increased mobility. And overall, it improves muscle function, which includes endurance, power, force, coordination, bone mass, muscle mass, and density, all of which assist in osteoporosis prevention. So as I mentioned before, there's a lot of research being conducted that attests to the effectiveness of whole body vibration. Previous studies were done a lot in the elderly population, and then recently, especially within the last 10 years, there's been a lot of studies involved with children with a variety of different diagnoses, a lot of which include children with cerebral palsy, and specifically within the pediatric population. So I'm just going to speak briefly about a couple of those different studies. So in one clinical study conducted in 2016, whole body vibration was associated with improved mobility in addition to increased muscle mass and bone density in adolescents and young adults with cerebral palsy. A randomized control study in 2014 found that isometric strength of knee extensors, spasticity, and walking speed were significantly improved in children with spastic diplegic cerebral palsy when they were provided with traditional physical therapy when compared to children treated with the same physical therapy program, but their program included the use of the whole body vibration plate. And then one more study I'll touch on is a systematic review of individuals with cerebral palsy. This was done in 2018, and the use of vibration was shown to reduce reflex excitability, spasticity, and coordination deficits. And the long-term effects were demonstrated in reduced muscle tone and spasticity occurring simultaneously with improved movement ability in regard to GMF, gait strength and mobility, as well as increased muscle mass and bone mineral density. So there's a variety of different studies that show that prolonged use of the vibration plate have a lot of great results in terms of muscle mass, coordination, body awareness, and most of these studies demonstrate the prolonged effects. There are also a few studies that demonstrate the effects that last just after one single session, but most of them are conducted demonstrating prolonged use. So the impact on spasticity, we have a lot of families that come to us and we're always trying to help them find different ways to manage spasticity. The whole body vibration, both our clinical observations that we see with our patients in the clinic, as well as a lot of these studies, demonstrate really good effects on spasticity, particularly in the lower extremities. So individuals with upper motor neuron lesions experience decreased modulation of spinal reflexes and experience a set of symptoms. One of this may include spasticity. Anti-gravity muscles of the arms and legs are most affected with spasticity. Some of these studies have demonstrated the application of vibration input. So when we're providing that vibration, they're getting intense vibrational input to the joints, the muscles. So it provides intense proprioceptive input that activates deep sensory receptors in their pathways, and this results in a modulatory effect. The vibration influences afferent fibers of the muscle spindle, which inhibits the monosynaptic reflex, and that's where we get this result of the depletion of excitatory neurotransmitters. So we're able to better modulate the movement and get more coordinated movements by influencing the deep sensory receptors. Hello. Let's see, there we go. So whole body vibration increases neuroplasticity by exposing the body to mechanical oscillations. The high rate of contracture result in greater impact on the musculoskeletal system in a shorter duration of time. And the high repetition that the vibration provides optimizes motor learning, and the stimulation of the neuromuscular system and neurological communication that we're getting optimize neuroplasticity. So how are these effects achieved? We utilize the plate in a variety of different ways within our treatment sessions. We can achieve these results by having our patients maintain static positions on the platform. So this may include developmental positions, such as maintaining a quadruped position, maintaining a variety of seated positions. We might have them do some isometric exercises. We can promote relaxation and stretching, get better stretching results on the vibration plate. And I'll go into more detail about how the different frequencies can help attain these particular results. We also have our patients complete a variety of dynamic activities on the vibration plate. So we might have them complete developmental transitions such as supine to sit, or transition from floor into standing. We might do some dynamic strengthening activities such as having them squat, some visual motor activities, and motor coordination tasks. So we might have our children sit or stand on the vibration plate and aim at a target, or catch a ball, all different kinds of activities based on the child's particular needs. So specifically the vibration plate, there are a variety of different vibration plates out there. A lot of the research that has been done conducted specifically with side alternating vibration plates. There are a couple models. The Galileo is one, the Hypervibe is another one. Our facility specifically uses the Galileo vibration system. So I'm going to speak specifically to this particular system, as it is the clinical standard in whole body vibration. They were the first ones to create the side alternating vibration plate. The Galileo is a certified medical device. It is supported by several peer-reviewed and published research studies that attest to its effectiveness. All these studies indicate that the frequency range, the type of vibration that is provided, and the variability that these plates provide are key components in the results. It's proven to be safe among a variety of different populations, and the contractions of the muscles can exceed 1,500 times per minute. Again, I'll go specifically into the different frequency ranges and what they all correlate to in just a moment. So one other, as I mentioned, the Galileo provides a side alternating movement. So some of the standard vibration plates have one plate that kind of just moves up and down in one plane. This has that two different plates that are moving in an alternating fashion. So this feature makes it particularly effective because one side's moving down as the other is moving up. And this imitates the movement of human gait. And this lateral tilting motion leads to rhythmic muscle contractions alternating between the two sides of the body. This further activates the postural muscles and minimizes the vertical movement of the spine and the head. So this is another reason why it's particularly effective and why it is safe for a variety of different patients, as well as some hardware that we might have within our bodies. The vibration forces experienced at compromised joints and at the head are gentler and result in increased targeted strengthening of the postural muscles. So then some other features that these plates offer are that right from the plate, you can alter the time, that the countdown on the clock, the amplitude and the frequency, and they're very easily adjusted right there on the spot. The Galileo also offers a wobble feature, so this is how we can further tap into neuroplasticity. It provides an additional balance and coordination challenge to the brain by randomly changing the frequency rates, and it prevents muscle accommodation by automatically changing the frequency at random. This prevents the neuromuscular system from adapting, and it allows the brain to learn faster. So who can benefit? At NAPA, we do see it, children with a variety of different diagnoses. Per the literature, and on the Galileo and Hypervibe websites, they have been proven to be effective and safe for children with a variety of different diagnoses, which may include cerebral palsy, traumatic brain injuries, spinal muscle atrophy, dystonia, muscular dystrophy, Down syndrome, spina bifida, spinal cord injury, and congenital cytomegalovirus. So is this safe for my child? As with any tool that we're going to utilize, we always need to review medical history prior to its use. However, the Gallo has been proven to be safe for individuals with shunts, screws, rods, pins, and plates, spinal hardware, deep brain stimulators, internal defibrillators, spinal cord stimulators, and baclofen pumps. So we do have a lot of children that come to our clinic with baclofen pumps and shunts, and it is safe for them to use. There are, however, some contraindications. As I'll go into further detail later, we do advocate for families using a whole body vibration plate in their home. We do have a lot of families that find it beneficial for the whole family. So we do want to just to kind of put it out there that there are some contraindications for whole body vibration may include pregnancy, acute thrombosis, implants or artificial joints on the trained regions, acute inflammation of the locomotor system, acute tendinopathy in trained regions of the body, and acute hernia, any fresh fractures in the trained regions of the body, gallstones in the urinary tract, post-surgery wounds, and rheumatoid arthritis. So we do need to take those into account when using the plate. So as I mentioned previously, the different frequency ranges have a variety of effects on muscles. So when we're trying to achieve a certain result, whether it be stretching or strengthening, we're going to keep our frequency at these particular ranges. The frequencies that you see on the plate are measured in hertz, and these refer specifically to the number of muscle contractions per second. The ranges of these frequencies provide different effects on the muscles and are determined by muscle physiology and the speed of nerve transmission. And depending on the frequency range, the muscle or body responds in different ways. So we describe these in 3 different ranges, low, moderate, and high, and I'll go into a little bit more detail about that. So the lower frequencies that we can set on these plates are between about 5 and 12 hertz. This is central control dominant, and it involves voluntary reaction to the movement controlled by the brain. When you're placing a child on the plate at this low frequency, you're getting active compensation of the tilt movement, and we utilize this mostly for mobilization and stretching, as the movement is not fast enough to trigger stretch reflexes. It allows for muscle relaxation, balance, joint position and awareness, mobilization, and pain reduction. So we usually utilize these lower frequencies at the beginning of our sessions when we're trying to kind of warm the body up, get that nice stretch that we want to get, and to provide that proprioceptive information before we go through some of our developmental transitions and activities. So after those lower frequencies, we can get to our intermediate frequencies, and the literature on this demonstrates that frequency set at about between 12 and 20 hertz is best for muscle function coordination, muscle stretching, proprioception, and spasticity management. So I'd say we utilize the higher end of these frequencies a little bit more often, particularly with a lot of our developmental transitions and activities within our sessions. At these intermediate frequencies, we're spinal cord dominant, so it is reflex-based control. There's a completion of the whole contraction and relaxation cycle, and muscle activity at these frequencies is based on reflexes, and the stretch reflex is triggered. So this is not consciously controlled. The muscle is being contracted without us being conscious about its contraction cycle. And then the last frequency range is our higher frequencies. We tend to, in our practice, kind of stay to the lower end of these frequency ranges. When we set the parameters at these higher frequencies, we're going to get an improvement in proprioception, fascia stretching, and spasticity management as well. So there is some overflow in the different areas, the high, intermediate, and low frequency ranges, as far as all of these different frequency ranges provide proprioceptive input. The intermediate and higher frequency ranges promote more spasticity management, and then the lower frequency ranges in the intermediate, you have that carryover between those two ranges in terms of muscle stretching. So when we're set at these high frequency ranges, we're getting maximum co-contraction and reflex-based control. The relaxation phase at these high frequencies is cut off and the muscle is forced into recontraction when it's about to relax or is partly relaxed. And again, this improves muscular coordination, endurance, and power. So a lot of high strengthening indicates for these higher frequencies. So now I'll kind of go through some of the different ways that we utilize the whole body vibration within our treatment. So as I mentioned before, our lower frequency ranges, so about 5 to 12 hertz, is going to be utilized for stretching. So this can be done in a variety of different positions. This is one example of stretching for the hamstrings. So our patient here has his feet on the vibration plate, hands on the bench. And the therapist can manually use her hands in order to get the optimal stretch through those hamstrings. We also utilize a lot to stretch the adductors and the gastrocs and the hip flexors, as those tend to be a little bit tighter, and we want to promote more stretching prior to therapeutic activities. We also utilize the vibration plate for static positioning. So in this example here, we have our patient in a quadruped position with his upper extremities on the vibration plate. So we can place the children in a variety of different developmental positions that might include forearm weight bearing, quadruped, tall kneeling, half kneeling, a variety of different standing positions, plank positions, a single limb standing if we're trying to get more into our pelvic stability. And then actually we are also able to get some oral muscle strengthening. And I'll show a video on that later and how some of our speech therapists utilize the vibration plate. So we can also use the plate with dynamic movement. We can do developmental transitions, as I mentioned before. This might include supine to sit, a heel sit to tall kneel. We can do modified push-ups on the vibration plate. We often utilize the vibration plate to complete transitions into standing. And again, we're getting so many more muscle contractions as we're going through these transitions. So we really want to maximize a lot of these developmental transitions that we're trying to promote. We often utilize them while completing squats, trunk rotation activities. We're always trying to get as much rotation through our patients' bodies as we can. Glute bridges. I'll demonstrate later how we can utilize the vibration plate with other tools that we have within our clinic. So we might have the children stand on the vibration plate or complete plank exercises with TRX straps. We utilize the vibration plate with scooter boards and therapy balls for a variety of different core strengthening activities. We have our children do a lot of step-ups, again, trying to load the glutes and the pelvic stabilizers. And then we also do some more dynamic standing balance activities. So we might have them reach outside their base of support, pull a weighted item. There's just a lot of different things that we can do on there to maximize our intervention plan. So we can combine, as I just touched on, different modalities that we utilize at Napa. So we recently started integrating the Galileo particular plate within our treatment practice in the last, I'd say, 3 years or so. We use it at across all our different locations in conjunction with a variety of different frames of reference, techniques, and tools. So we utilize it with one particular intervention that we offer at Napa, which is dynamic movement intervention, in which we're trying to promote automatic postural responses. So we'll use this to kind of maximize once we've gotten the child into the transition that we've wanted them to achieve or get them into that upright position. Then we can maximize the strength that they're going to be gaining and the proprioceptive information that they're going to be gaining by completing these transitions on the vibration plate. We'll use it with the NeuroSuit, which is, again, another tool that we offer at Napa. It's a series of vest, knee pads, and shorts attached by bungees. That's a part of our intensive model of therapy. We will often utilize Theratogs. We use that a lot within our practice, and we'll combine that with the use of the vibration plate, as well as with kinesio tape. So I might have some patients that I'm trying to get really good weight bearing through the arms. I might place tape on their wrist extensors, or I might place some tape somewhere on the arm and get the optimal alignment of the arm before placing on the vibration plate. And then we're getting that added benefit of the best alignment possible while getting that strength and coordination and stretching benefit from the plate. So as I mentioned, we utilize this both in our traditional and intensive models of therapy. And it is utilized by all of our practitioners, our speech therapists, our OTs, and our PTs all have different uses for the vibration plate. So as I mentioned, this is the NeuroSuit, and this is one of our patients during his intensive utilizing the vibration plate. As you can see here, the plate's placed on a tilt board. So there are a couple of different models of the plate. Some are a little bit more portable than others. This is the Kitty Galileo plate that our patient here is on. We're able to pick this up and kind of place it in a variety of different tools or in different positions, which is nice. And then, so this is him kind of getting some lateral weight shifting while he has the suit on. So again, trying to maximize the exercise that the therapist is putting him through here. As I mentioned, we'll often use scooter boards, TRX straps, therapy balls in order to, with the use of the vibration plate. So our patient here is going through an upper extremity strengthening and core strengthening exercise on the vibration plate. His knees are on the scooter board and his upper extremities are on the vibration plate. So he's getting that load through the arms, the shoulder stability. We're trying to work on his head control and then his core strengthening by placing his knees on that dynamic piece of equipment. So our physical therapists in general find a lot of great use for this tool, as it helps to promote a greater strengthening of the pelvic stabilizers for standing and gait mechanics. They often utilize it for strengthening the postural muscles to maintain a variety of developmental positions, for maintaining range of motion, flexibility, and contracture prevention. They'll often utilize it to improve body awareness, balance, and coordination for developmental transitions and movement sequences, and general strengthening for power and ballistic movements such as jumping. So in this example here, we have our patient who's, again, doing his intensive program with the NeuroSuit on, and our therapist, our PT here, is going to be demonstrating a squat to stand transition. So he's going to be getting a high rep of muscle contractions as he's doing his squat into standing. So we're really able to load his glutes and really get his pelvic stabilizers going to assist with his upright mobility, his sitting positions, his overall balance and strength. So this is another example of our stretching. This is just a video of the picture that was demonstrated before. So he's got his arms on the bench there, and he's getting that nice stretch through his legs as the therapist maintains her hands and tries to further provide a little bit of manual compensation to get the maximal strength benefit from there. So I'm an OT. I've seen a lot of really great gains in upper extremity strength and control. I find as an OT, a lot of our patients, I would say, have a harder time tolerating upper extremity weight bearing. I have a lot of parents that come in asking, how do I maximize tummy time at home? The nice thing about the vibration plate is I have seen a lot of children who maybe day one aren't tolerating much weight bearing for very long. We put them on the vibration plate, and I think in part due to the sensory input that they're receiving and actually tend to enjoy. They're able to tolerate the weight-bearing positions for longer. They're getting a lot more joint awareness, which I think they find they kind of sense their body position in space a little bit differently, so they tend to enjoy it. A lot of our kiddos do like a lot of high intensity input, whether that be vestibular or proprioceptive information. So sometimes all that information coming to their body can be enjoyable. So we'll often utilize the vibration plate for proximal strengthening of the shoulders for improved distal control of the hands and fingers. So I often like to put a lot of our patients on the vibration plate prior to doing, that's often my first activity that I'm going to do with a lot of our patients prior to going through any of our developmental transitions, or if I'm doing working on a self-care skill or a writing skill, basically anything, reaching for a preferred object. I find that just kind of promoting that body awareness in space and strengthening is going to be a great way to start the session. It improves upper extremity strength, as I mentioned, for self-care skills, improved hand strength for writing, typing, and accessing keys on a device. We'll often utilize the vibration plate for improved strength of the trunk and pelvic stabilizers for dynamic upper extremity use and play. So as I had our patient in the previous video, with his hands on the vibration plate and knees on the scooter board, we're really able to get more muscle contractions to the postural stabilizers and the upper extremities, so that we're able to have a more stable base for sitting, and which will allow for better coordinated movements at the upper extremities. It allows for improved upper extremity strength to stabilize and maintain grasp on assistive devices, and the sensory input to promote increased organization of behavior, attention to task, and to prepare the body for learning. So prior to working at Napa, I did work at a sensory integration clinic, and we often utilize the vibration plate as well. It wasn't quite the Galileo vibration plate, but we found that providing that intense input also further helped with just organization of behavior in order to attend to a variety of tasks and to give the kiddos a high intensity input that a lot of our bodies are craving. In this example, this is another example of a dynamic upper extremity activity, a core strengthening activity. So with this patient in particular, we're really focusing on weight bearing through that right upper extremity. We previously, at the beginning of our intensive, our child here did a 3-week intensive with us. He wasn't able to sustain right upper extremity weight bearing in that quadruped positioning and that crawling position for very long. We used the vibration plate every day and did static quadruped positioning. We did some quadruped positioning with unilateral reaching, and he was able by the end to sustain weight bearing through that right arm while reaching with the left, both on the vibration plate and without the use of the vibration plate. So it seemed as if that continuous repetition of these exercises in conjunction with the vibration plate really maximized his ability to maintain that stability while weight bearing through one arm. So I'll demonstrate here. And when we place the kids in quadruped on the vibration plate, we can put their knees or their arms on the plate. I tend to put their arms on the plate as I'm usually trying to promote better upper extremity strengthening through the shoulder girdle and to get better head control. And here's another example of some upper extremity and core strengthening. In this example, our patient has her legs suspended in our TRX system, and then she has a little bit of support at the pelvis just to make sure that we're in proper alignment. And she has her hands on the vibration plate. She actually has her hands on a foam pad on top of the vibration plate, so we can also put some other padding on top of there, for particularly if our knees or our forearms are going to be on the plate. Some of the kids also like to vocalize a lot on the vibration plates, kind of make their voices sound different, so that can be a fun game. And also just by the nature of getting a lot of, sometimes our speech therapists do ask, how come we get so many more vocalizations in your sessions, and then they come to our speech therapy sessions and we can't get them to vocalize as much. And a lot of times, and it is nice because I feel like recently our speech therapists have started utilizing the plate because you're getting into that vestibular system, which can help initiate that movement and speech production, and then also just that awareness that their body's getting and the increased postural strength that they're getting can help with further vocalization. So going into our speech therapy, our speech therapists do utilize whole body vibration for strengthening of the oral muscles for speech, feeding and swallowing, for strengthening the postural muscles for airflow and voice production. They'll utilize it to strengthen the neck and postural muscles for optimal communication device use, sensory input to facilitate initiation of speech, arousal level, and body awareness for articulation. They'll utilize it for secretion management, and in the next video, I'll demonstrate how we can promote that. And then also for postural strengthening and body awareness for optimal sequencing of breathing, coordination, and phonation. So in this video here, you'll see our patient is, the speech therapist is asking her to place a popsicle stick between her lips while she's being supported and standing on the vibration plate, and the goal there is to see how long she can. So this is a patient who just started an intensive this past week. I think the speech therapist, this was the first time she tried it with her, and she kind of timed to see how long she could maintain it within her mouth, and I think she said it was about 10 seconds. So they're going to try this daily and see throughout the 3-week intensive how long she's able to maintain it over time, to see how much strength she got through those oral muscles. And part of the reason that they're utilizing this here is also for secretion management. So in this, I'll demonstrate how that's being done there. And again, this can be done in a variety of different positions. She could have also have done this seated. They chose to do it in standing in this example. So part of our program is we offer, again, weekly traditional sessions and then our intensive sessions. Our intensive sessions are 3 weeks long, and at the end of the 3 weeks, we provide families with a home exercise program. We feel that home exercise program is really important for the carryover and just to further attain all the goals that we're trying to attain. So we advocate highly for the use of a vibration plate at home in conjunction with the home exercise program. The high rates of contracture provided by the whole body vibration can provide 4,500 muscle contractions in 3 minutes. So 10 minutes of exercise on the Galileo can equal over 1 hour of exercise. So we know that families are very busy. So one great thing about the system such as the Galileo is that you can really maximize the exercises that you're doing. We know a lot of families might have, they say we have 20 minutes to spend on our home exercise program 4 days a week. So we'll give them the exercises that we feel will be most beneficial for them to complete in conjunction with a vibration plate, if that's the route that they're going to go. When families do let us know that they plan on getting a vibration plate, we provide them with the parameters, duration of time, number of repetitions, and the exercises that they should perform on the vibration plate. And then, as I mentioned before, there's benefits for additional family members. So we have had some families that have that find it helpful for their grandparents, for the child's grandparents. For a lot of our families, parents are starting to experience some back pain, so that can benefit them as well, or some siblings that might find some use for it. I know my own father called me the other day, which was funny that I was presenting on this, because he had seen some commercials on the TV for vibration plates, and as he's getting older, he was asking if I found that to be effective, so I was kind of giving him some information on some of the plates as well. There are a couple different models that are available. We have 2 within our clinic, and these are the 2 that I find that parents do tend to kind of go towards more. There's the Kitty Galileo, as I mentioned. It's much more portable. I want to say it's about 40 pounds or so. So it's not too heavy. It can be placed on, sometimes we'll place it on top of a scooter board. It can be placed up on a bench. Just depends on how it's going to be utilized. There's also the S25, and that tends to be used a little bit more for families that intend for the whole family to use it. It's meant for use for adults and children. Those do tend to be a little bit heavier, so they're not quite as portable. They can be moved around. We do move them within the clinic. It's just a little bit tougher. So our families that are trying to use the system a little bit more dynamically, we advocate more for the Kitty model. However, both can be moved around. So there are additional resources available with a lot of great information. Galileo has a lot of great information just on all the different research that's available. They have tons of different studies done in over a lot of different populations. They have they do have other pieces of equipment. They do have like a vibrating dumbbell that seems really effective. They have just a lot of great information on their website. They go into more detail about the specifics of the plates and all the different features that it offers. Hypervibe is another model that I've mentioned. We do have a lot of families that do get the Hypervibe. The biggest difference between the Hypervibe and the Galileo, they're both side alternating plates, so both are supported by a lot of the research that has demonstrated the effectiveness of whole body vibration. The biggest difference is that the Hypervibe doesn't have that wobble function that the Galileo has. Both are really great devices though. On our website, we do have more information about Galileo and how it's utilized within our clinic. And then we do also Napa, and I know some other different doctors' offices do have a partnership with Galileo. So patients who are interested in purchasing a Galileo device are able to get a discount. I know some doctors who do certain procedures do also have that partnership with them as well. And there are some offices also that do have a partnership with the Hypervibe. And then after that, just some more information on some of the research that's being done. Again, Hypervibe and Galileo both have a lot of really good links to a variety of different research studies across various populations. And that's the vibration plate.
Thank you.
Thank you.
Any questions or anything?
Can you tell me more about the wobble function? How is that
Oh, yeah.
different?
So basically what it does is you'll put a particular frequency, you'll set the frequency that you want it at, and there's a couple different wobble functions. So you can put it at wobble 1, wobble 2, and basically what it does is it'll at random, so if I set it at a frequency of 20, it'll at random have the frequency change from 20 to 21 to 22 back to 19, 20. So that doesn't allow for the brain to kind of adapt to that particular frequency setting.
For surgery, what are you talking about as far as, is it in the use of, you said, to help?
Oh, post surgery. I know.
What surgeries are you?
So I know Dr. Park, who does SDR, and then also I know he has a partnership with Hypervibe and Galileo. We have a lot of kids that that we do have to wait a little bit post SDR surgery to use it. SPML, we do have a lot of kiddos that get SPML surgical procedures. So after those therapies, after they've had some time to let their bodies kind of recover, then we want to maximize the benefits of the strength training that we can get from that. So I know that those doctors are advocates for use of vibration plate post surgery.
Any other questions? No? Awesome. Thank you, Erin.
Thank you.
Thanks.
Thank you.
I'm sorry, I did have a question. Is this shareable? Can you email it? Or
Oh yeah, they are putting everything on the Team Luke
Yeah,
website.
so they're gonna have both the presentation and the PowerPoint available to you guys, and I wanna say it's next week. So they're
Perfect.
gonna be doing the whole conference.
Okay, awesome.
Yeah, very cool. So you guys will have all the references and everything.
Yes.
Thank you.
Did you have a question?
I have a question. So when you're doing the vibration, do you recommend wearing shoes or not wearing?
Well, that's a good question. Both, actually. For some of our kiddos, and Caitlin could probably talk specifically, sometimes we're really trying to get into the how the feet are being placed on there. For some of our standing transitions, we might have them stand on the plate with their shoes on, but I know a lot of our PTs do utilize them with shoes off to really.
Yeah, and sometimes in particular this week I used one with a kiddo who sometimes his feet come up in his shoes, so I want to get the max benefit of getting his foot flat on. So I was able to actually, I took his shoes off, everything, and they get a little bit more input too when so you don't have any barrier from your socks to your shoes, or if they're wearing their braces. So then sometimes I will tilt the Galileo up to maybe get so they can get their whole foot flat on there, and then we can kind of gradually decrease that as long as they've been standing on there too.
Thank you.
But a lot of this, it was older kids, is their use for infants as well?
Yes.
Because mine's an infant, not, he'll be 1 in January. So what benefit could he get out of this versus?
Yeah,
he's not crawling, he's
right.
not rolling, he's
A lot.
not, yeah.
A lot of our kiddos, we do. I would say the youngest, I mean, you can put children on the plate fairly young. I would say the youngest I've put on there is about 4 or 5 months old. So we do a lot of just upper extremity weight bearing, for like prone positioning, prone on forearms. I do always put down a mat if they're going to be particularly on their forearms or their knees. I always put a cushion on the plate. Just because it is a hard plate, and a lot of the kids, even when I have just the hands, you saw in that one video, a lot of the kids tolerate just their hands being on the plate, but I do find that just kind of having some kind of yoga mat or something is helpful. But we do a lot of like prone on forearms and just trying to get a lot of times we'll do some of our prone positioning with rotation, particularly if we're a little bit more limited in rotation to one side. So we'll use it a lot of times as a precursor to working on army crawling or rolling, or just trying to get a little bit better activation of the neck muscles against gravity. Really trying to get by weight bearing through the arms, we're really helping with that head control just by getting the shoulders involved a lot. So we'll do some prone positioning, some quadruped positioning, sitting on the vibration plate. We've done a lot of that. Some kneeling on there. So all the different developmental transitions. I would say the one thing I don't do any rolling on there, but a lot of like supine to sit or prone to sit, or again that static positioning we'll do a lot of. Yeah.
How much time would you say you're using the plate per child?
It does depend a little bit per child. I recently started integrating a little bit more often than I was in the past. I would say as a preparatory method, we'll usually put them on, a lot of the research does indicate doing about a minute to 2 minutes, depending on what the exercise is, and then doing a little bit of a rest period. So I might have them, and then it depends on if it's going to be upper extremity or lower extremity weight bearing. If I'm having the child maintain like a quadruped position, it's going to be a little bit more challenging to maintain the upper extremity weight bearing for a prolonged period of time. So I might have them do about 45 seconds to a minute, and then give them a 30-second to a minute break, and then put them on there. So it's not 10 straight minutes, but I might do 10 minutes of activity on the vibration plate, putting them through 3 different exercises. I might do 3 rounds of quadruped positioning with a break in between all those rounds, and then I might do tall kneeling, 3 rounds for a minute in a tall kneeling position. So I'd say somewhere around 10 to 12 minutes. For some of our children, we do go back to the plate, so I might use that as a preparatory modality to wake up the arms before doing like a prone to quadruped transition. Or if I really want them to load the upper extremity for a sitting transition, I might get the arms on there. And then I might work on the mat for a little bit, and then I might go back to it before I do a different transition. we also find that because of that intense input, it really helps with our alertness and arousal level. So sometimes we find that our kiddos are getting a little bit sleepy, so we might put them back on the vibration plate, and then they're kind of alert to their body and kind of wakes the body up again and prepares them again for another developmental transition. So a lot of times we do go back. We're always kind of assessing the child's needs in the moment. So maybe one day I spend the first 8 to 10 minutes on the vibration plate preparing the body for developmental sequences, and that might be the only time I use it throughout the rest of the session. And then the next day, maybe I'm noticing that, righty arm looks like it's having a really hard time pushing. I'm going to put them back on the vibration plate and see if that helps with it. So there's going to be all different clinical reasoning as to why we might go back to the plate one day versus not another. Or some days, as I mentioned, it's utilized a lot for spasticity management. A lot of the research indicates it's really good for particularly the knee extensor, management of knee extensor reflection spasticity, so trying to get it more extended. There isn't a ton of research, but there's been a couple that demonstrate that after one single use of the plate, it's effective for a couple hours. So I have had some patients who have one day their spasticity really seems to be working against them a little bit more. On a particular day, I might go back to the plate, and I have found it pretty effective for regaining kind of better motor control in the moment.